So this is the woman who's responsible for putting this conference on here, right? If it wasn't for Carolyn, we wouldn't be in these rooms. So Carolyn found these wonderful babysitters, worked with catering, made sure no one else could steal any of these rooms, corralled the scientists and said, you really do need to send slides to Susan because we need to project something. So this is the woman who's responsible for this. As a volunteer. This is all in her spare time for our kids in our community. So Carolyn, thank you.
I was going to say, Susan was a primary counterpart in all of this planning, so I will only take 50% of the credit, but I'm also only going to take 50% of the blame if you didn't like anything. All right, so we've taken a deep dive today into a lot of different topics, starting with different manifestations and clinical concerns that you have, taking a dive into different research that has gone on. And so my goal as we approach the end of the day is to step back and take like a bigger picture look at how this all plays together. So the way we're going to do that is we're going to talk about process, discovery, and then a few considerations. Research is a word that's been thrown around a lot throughout this entire weekend and in general with the goals of this community. But just to summarize it, research could be a lot of different things, but I thought this definition covers all those different things, and that it's a continuous process of creative and thoughtful work to discover new information and increase understanding. There's a lot of people in this room that are creative. Yesterday in our research meeting, we had a little chat about how creativity probably ties to how quickly you get your slides in. So we have a lot of creative people in this room. And then that it's really thoughtful work too. And so I think everyone in here has their heart in this topic. But where I'm going to focus is more on the words up here, process and discovery. So this is what the research process looks like broadly. Starting on the left side of the screen, we have the natural history of SKS. And so, Smith-Kingsmore syndrome is something that we haven't known that name of that condition for all that long. And so the first piece that we needed to understand and are still working hard to understand is what is Smith-Kingsmore syndrome? What does it look like day to day for families? And what are you all experiencing and what can we help you with? So that includes, or how we do that is including registry data. So there is a registry through the Smith-Kingsmore Syndrome Foundation. Yes. Go look it up on the beautiful new website, check it out, and find the registry. So these are surveys that you can fill out. It walks you through the whole process. There's several questionnaires that you can do by working through the biorepositories that our teams have. So Lindsay here is a key player in helping families find those questionnaires, talking through how they'll work on them, and also the consenting process and what it looks like to participate in research. And then also chart review is another tool that we have as well. So that is clinicians and researchers going in and looking at medical records to understand our patients better. The other piece here is functional studies and drug targets. So that's kind of what we talked about second today, looking at animal models or cell lines and drug repurposing and understanding or using that to understand how we can try to treat Smith-Kingsmore syndrome. So we need to know first what our symptoms are, what our concerns are. Annie highlighted some of the things that have come to light through some of the research that's been done already, and then how do we take those symptoms and prioritize being able to treat them. And this takes so many people, and so many of them are here in the room today, which is great. But both of these things, if we look at them together, what they do get us to is that next step of clinical trials and treatment. So this can look a lot of different ways, and I think we're still trying to figure out exactly what that can look like in the Smith-Kingsmore syndrome community. In general, you'll see a lot of different phases of clinical treatment or clinical trials. And so in research, we're looking to understand, or in human research, when we bring it to patients, we're looking to understand safety. We're looking to understand how well a treatment actually is working and if it's something we should keep pursuing. And then we're also trying to look at that long term, because there are definitely times when things work in the short term, but then if we keep looking at it over time, it doesn't actually play out to be helpful. And so those are all things that we have to keep in mind. And then finally getting to FDA approval is really helpful because that helps us with awareness, but it also helps us with insurance coverage for treatments too. So diving a little bit deeper here, I feel like I actually talked about a lot of this stuff, so I'm going to make sure that we keep going through. But this kind of just like plays out in the long term how we have to look at everything. But looking at the natural history of Smith-Kingsmore syndrome, taking these functional studies, what all of that combines to is preclinical data that helps us then make a case for doing a clinical trial. And that data is super important for us to be able to make a case for moving forward with a clinical trial. And it's a long road even once we get to that treatment phase, but I know everyone in this room has the strength to keep moving forward. The last piece that I want to touch on real quickly is just considerations. So I know when families sit down to fill out questionnaires or fill out the registry, that can be a long time commitment. I don't know if any of you have tracked how much time you have spent, for those of you that have participated in any of our research, or the emails back and forth, or going through a consenting process. But everyone comes to research with a different level of comfortability. And so it's important to know what that is for you, and we're happy to meet you wherever that is. So there's lots of people in this room that are going to help you talk through that. These are just some of the questions that you can take into consideration while you're trying to decide what level of comfortability you have. Like, again, what is the time commitment? What does participation look like? What am I signing up for when I say, yes, I want to do research? What is the collected data being used for? So how we're actually using the information that you are willing to share with researchers, and what other options are available. So maybe one research effort isn't something that you're comfortable with. There's usually more than one because we're looking at lots of things at one time. So know that the researchers in this room want to meet you where you're at with your research and talk through what your comfortability level is with clinical research. But that is actually all I'm going to do. I'm going to keep it short and sweet and get us on to questions.